It wasn't long ago when activists went on a crusade against tobacco in response to all the health complications that may come as a result of prolonged tobacco use. Big tobacco was killing people, they said, and by advertising tobacco to children and getting them hooked, it ends up hurting those kids someday. And that's bad. Many health experts also backed the campaign against tobacco because of the long-term health effects. Today, no longer are health experts or activists concerned with negative health consequences. In fact, health experts remain largely silent when leftist campaigns at every turn are infecting Americans. And in this video, we'll cover 5 ways Democrats are making you sick. And physicians, the people we rely on to provide us care, remain largely silent, and through their silence are complicit in the infectious spread of illness and disease throughout Americans. The San Diego River is the largest local source of drinking water for San Diego County, and homelessness encampments began to pop up along the San Diego River, leading to piles of garbage and waste.
But bacteria from human sources of fecal waste, that is the kind of stuff that carries pathogens that can make people sick.
David Gibson, executive officer with the San Diego Water Board, says the San Diego River is heavily contaminated.
And while we've all known about the border issues in the Tijuana River watershed, it was surprising to find out that there was actually a lot of human waste present in the San Diego River watershed. There are organisms like noroviruses that cause massive illnesses on cruise ships, for example. We're finding those types of viruses in our waters.
Gibson says studies conducted over the last few years show where the stuff comes from. One reason is the homeless population along the river, people who defecate near the river, ignoring the warning signs.
Some of the people who are camping in the river right over here or living in the parking lots are not using toilets. They're using whatever happens to be available. And when you put that kind of fecal waste into the watershed, you are potentially putting the pathogens that can make people sick into the watershed as well.
Tracking the spread of infections caused by homeless waste is difficult because most people don't even associate a stomach problem with a recent weekend swimming or boating in the water. In one study of 654 surfers, researchers noted a 3-fold increase in ear infections and 5-fold increase in infected open wounds. Exposure to seawater in California meant exposure to human fecal matter. Sacramento County put up signs warning people to wash their hands after touching the water and not to drink the water or even swim in the water if they have open cuts, while blaming the E. coli contamination on bacteria from the intestines of mammals, which is scientifically true. However, the mammals that are infecting the river are people, particularly the homeless camps nearby. Now the filth of left-wing policies is filling the Sacramento and American rivers. E. coli levels at beaches are supposed to be at 88 or below, and anything over 1,000 is supposed to lead to a beach closure. But at Discovery Park, the numbers went as high as 2,419 in December of 2019. Meanwhile, at Tiscornia Beach, at the confluence of the American and Sacramento rivers, the EPA's threshold, a level of contamination that would make 32 out of 1,000 people sick, had been repeatedly exceeded. A professor actually referred to the samples of the river water as diluted sewage. That's a problem considering the American River is used to provide drinking water to Sacramento. And while there are many other health consequences of the homeless problems in these left-wing cities, you won't hear much from doctors about it. It's more likely you'll hear doctors clamor to Democrats calling for more free money or goodies to shower the homeless with instead of calling them to be removed from the streets because of the public health consequences. Speaking about the environment, left-wingers really love and care about the environment. Forget all that stuff about letting the homeless defecate in your water systems. Democrats are so worried about the environment, and they'll tell you about it through mountains of global warming propaganda and hysterical doomsday scenarios that never come true. But all of this global warming hysteria being pushed on young children about how they're going to die is actually spawning a new form of anxiety disorder doctors are calling climate anxiety. But nothing that years of antidepressants on a young child can't fix, right? I'm sure that will be great for their development. If you haven't been paying attention, there's also a very much pro-obesity movement going on among left-wing circles, because no longer is the main concern discouraging behaviors detrimental to health. Nope. College professors now lecture that medical fat shaming at the doctor's office is mentally and physically harmful. The professor asserts that doctors are advising weight loss for fat patients rather than giving them CAT scans or blood work, and commit microaggressions by wincing at their medical charts. Even celebrity fitness guru Jillian Michaels would be attacked online for saying that being obese is not a good thing and we shouldn't publicly celebrate obesity of people like Lizzo. And she's right, but she would be scorned for her hate speech throughout the media. However, a study published in the Journal of Obesity found that the normalization of plus sizes in this age of body positivity may actually be feeding the obesity epidemic. The study suggests that the increasing in advertising of plus-size models is contributing to the obesity epidemic by normalizing the social stigma that's traditionally been around it. Another way Democrats are making you sick and your doctor doesn't care is through STDs. In 2017, California had more than 300,000 cases of chlamydia, gonorrhea, and syphilis, setting a new record, a 45% jump in just 5 years. Remember when we were told that the sexual education being mandated as part of school curriculum would reduce this stuff, and that the suggestion that we preach abstinence to young people was foolish and outdated? Well, the Democrats won that battle, and look at the wonderful graph of skyrocketing STDs, but you know it's not their fault. It's that we should be pushing sex on kids at younger ages. Yes, we should have teachers conduct role plays with children in sexual scenarios so they know how to be safe. Anyone who suggests that sexual education, including graphic homosexual photos and perverse sexual discussions with teachers, might be normalizing adolescent sexual activity and thereby increasing the spread of STDs. Anyone who says that should go back to 1950 and stop trying to oppress women and gays and stuff. Despite the correlation between sexual education and growth of STDs, few, if any, doctors say anything about it. If they did, they'd be scolded as trying to harm children by keeping them ignorant of the dangers of STDs. Instead of attempting to deter children away from sex, they normalize it and instruct them how to do it. In fact, the more young people are infected with STDs, the more they actually double down and urge for more funding and awareness to children of younger and younger ages. It doesn't matter if the studies show that abstinence-only education actually does reduce rates of sexual activity, or that even the CDC acknowledges that women who wait to have sex are actually much healthier throughout their lives by forming good habits of self-discipline. It doesn't matter if there's a plethora of studies that show a strong correlation between more sexual partners for women and suicide, suicidal thoughts, depression, anxiety, and even some studies with 10 or more partners, the risks of cervical cancer. It doesn't really matter if all this stuff comes out, because suggesting women refrain from promiscuous sexual activity is so 1950. But medical professionals won't dare challenge the sexual revolution movement or preach the teaching of abstinence for public health reasons. And they definitely won't take on the LGBT movement, even if in 2014 gay men accounted for 83% of new syphilis cases, or when the rate of anal cancer is 17 times higher among gay men, or when 1 in 7 transgenders have HIV. Your doctor won't say a word. Media outlets like Vox even write news pieces calling for the decriminalization of laws against an HIV-positive person not disclosing their HIV-positive status to sexual partners, because making them do so only increases stigma for HIV. California has even reduced penalties for people not disclosing their HIV-positive status to potential partners. Now, they could be right that criminalizing having sex with another person without telling them you have a deadly disease that you could pass on to them may not actually deter gays from disclosing their status. And that's because gay men seem to just not give a crap if they infect others with HIV. At least that's what the data says. Studies show that 60% of homosexual men fail to report their status to all partners, and in fact a staggering 51% with AIDS, not just HIV. Full-blown A's fail to disclose their positive status to partners. So if it surprises you that there's a lack of interest in preventing the spread of HIV among gays, it shouldn't surprise you, because the LGBT movement is probably the most narcissistic movement out there. There are actually movements among the gay community to push to allow sexually active gay men to donate blood. In the past, active gay men have been banned from donating blood due to gay men being a much higher risk to have a blood condition like HIV, and then they can transmute that infection to an unsuspecting patient who needs blood. But of course, such policies are discriminatory. Gay men in France say so. In France, they don't allow gay men to donate blood unless they've been celibate for a year. But even more lax rules on gay men donating blood in the UK are no good also. There, you only have to be celibate for 3 months before you're allowed to give blood. But the 3-month wait is discrimination and homophobic, and so gay men are donating blood anyways. This rule is totally not about the patient's best interest, and definitely because society is colluding to covertly discriminate against gay people. There's also a growing movement in America to allow potentially HIV-positive gay men to donate blood at your local blood bank, because not doing so is homophobic and discriminatory. And if we've learned anything about the LGBT lobby in America, they'll probably get their way in due time. So if your 12-year-old daughter or granddaughter gets in a car accident and needs a blood transfusion and leaves the hospital with HIV, well then screw her, I guess. But you won't see your doctor speak out opposing the sexual revolution movement in school, or these shocking consequences and health effects of the LGBT movement and lifestyle. And one more way the left is making people ill is through abortion. And I'm not talking about the baby being murdered or the mother having physical complications caused by the abortion. That's not what I'm talking about. One of the few things doctors are willing to mention is the serious and often life-threatening psychological consequences for women who have abortions. Study after study show the same thing. Women who have abortions are far more likely to experience depression, anxiety, substance abuse, suicide, and many other forms of psychological trauma after having an abortion. In October of 2017, a new research report found that suicide is 6 times greater for women who have an abortion compared to women who give birth. Women who had abortions experience mental health disorders 30% more often compared to women who had not had an abortion. A 13-year study found that compared to women who have not been pregnant in the prior year, deaths from suicide accidents or in homicide are 248% higher in the year following an abortion. Another study found an increasing number of counselors are reporting that unacknowledged post-abortion distress is the causative factor in many of their female patients, even though their patients had come to them seeking therapy for seemingly unrelated problems. A 5-year study found that 25% of aborted women made visits to psychiatrists as compared to 3% of the control group. Women who had undergone an abortion were 2.9 times more likely to have significant depression, 2.8 times more likely to have alcohol problems, or 7.7 times more likely to use other illegal drugs after their abortion. Studies in the UK, studies in America, in Scandinavia, in Australia, and New Zealand all show similar results. Suicide ideation, 61% increases, alcohol dependence, 188% increase, drug dependence, 185%. The only difference was whether their alcohol dependence increased by 61% or 30%, or whether their depression increased by 30% or 300%. Study after study after study show the same thing. There is a consensus among most social and medical scholars that a minimum of 10% to 30% of women who abort suffer from serious, prolonged negative psychological consequences. But if you think the results are conclusive enough that your doctor will say something about it, think again. In fact, the largest association of American mental health professionals, the American Psychological Association, disagrees. Evidence be damned. But this shouldn't be surprising because the American Psychological Association is not actually a medical or scientific group at all. It's actually a left-wing political activist group who was at one time objective, science-based medical researchers, similar to other groups corrupted by left-wing interests like the DSM-5. If you want proof, the APA is so left-wing, it regularly pens articles about the dangers of masculinity, saying traditional masculinity is psychologically harmful and that the clinician's role is to encourage men to discard the harmful ideologies of traditional masculinity. The APA is also a major champion of boys going into girls' bathrooms and shooting up children with puberty blockers and cross-sex hormones. In fact, the APA is so pro-LGBT they now require authors to use the singular they pronoun. The APA also has a non-monogamy task force which regularly advocates for polygamy, claiming that people who practice polygamy are marginalized. Remember, this is the group that says there's no adverse psychological effects to women who have abortions. One of the heads of the APA's polygamy task force, Amy Moore, writes breathtaking in-depth medical analysis piece like Moving Past the Rose-Tinted Lens of Monogamy, among other writings in prestigious publications like the Journal of Bisexuality. The other leader of the APA's polygamy movement, Dr. Heath, also has a long list of publications like The Psychology of the Threesome. But don't worry, the APA is a very sound and scientific group. It would never let a partisan agenda get in the way of its research. And when they say there's no psychological consequences of women who have abortions, it's totally objective-based research, and they would never try to scrub that evidence for partisan reasons. Democrat politics is literally causing health crises all across the country. We see the consequences in women, in gays, in children with STDs, in climate anxiety, and in the homeless defecating in your drinking water. But you'll be hard-pressed to find doctors willing to speak out about this. Doctors know this stuff is going on. They're not oblivious to it. They just don't care enough to call it out in fear they might be called one of the long list of names that Democrats always call Republicans who highlight the negative consequences of leftism. And as much as it pains me to say, through their silence, doctors are complicit in spreading illness and disease. And the next time you visit your doctor, feel free to ask them why they won't speak out about any of it.